Good morning, everyone. Thank you very much for joining us for our webinar today. My name's Laura Katawaki, and I'm going to be the moderator for the webinar. I just want to make sure everyone knows that the webinar is being recorded, so you will be able to view the webinar afterwards on Healthy Aging Core BC. Our webinar today focuses on the Choose to Move program. And Choose to Move is a free and flexible program that's available to older adults in BC and provides them with the support and motivation in order to help them become more active. And so today we're going to have the opportunity to learn more about the Choose to Move program and then also learn about how you can bring this program to your community. Before we begin the webinar, I'd like to do a land acknowledgement. And so I'd like to acknowledge the homelands of the Indigenous peoples of this place we now call Canada and honor the many territorial keepers of the lands on which we work. And I specifically am currently working today on the traditional, ancestral, and unceded territory of the Coquitlam First Nation. And I'd like to thank them for their continued stewardship and care for this land. And I would encourage all of you in the chat, if you'd like to take a moment to introduce yourself and also to acknowledge the land that you're currently working on. And a few housekeeping items before we get to the presentations. Everyone will be muted except for the presenters. Your camera is welcome to be on or off, depending on what your preference is. As I mentioned, feel free to introduce yourself in the chat box and also to acknowledge the land that you're currently working on. And for the presentations, there's going to be some pauses throughout for questions, and there'll also be a question period at the end. So you're welcome to use the Q&A feature or the chat in order to ask questions. And as I mentioned, the webinar is being recorded and the slides are going to be hopefully made available. We'll be able to share them with you afterwards, as well as any links that are shared during the presentation. And I see we already have a Q&A. Oh, it says the chat is disabled. So I will ask our tech whiz Ravi if he's able to get the chat going. And so for now, you can use the Q&A for any questions. So thank you for bringing that to our attention. The webinar for our agenda today is pretty straightforward. And so we're going to have presentations by two members of the Active Aging Society who are working on the Choose to Move program. And the presentations will be by Dr. Joni Sims-Gould and Krista Hoy. And so I'll provide a brief bio for each of them before we get started. Dr. Joni Sims-Gould is the Executive Director for the Active Aging Society. She's also the Principal Scientist of the Active Aging Research Team and a Clinical Associate Professor in the Department of Family Practice at the University of British Columbia. The goal of her work is, simply speaking, to add life to the later years. And with the Active Aging Research Team, she's involved in designing, implementing, evaluating, and the scale up of the flexible health promotion intervention Choose to Move, which is for older adults. She also assesses factors that influence older adult health indicators such as mobility, social connectedness, and mental health. And she evaluates the translation of research findings for different groups to optimize impact. Joni works closely with a broad range of partner groups that span BC and beyond. And as a registered social worker, she's sensitized to overriding issues of power, privilege, and inequity, and applies a sex and gender-based analysis approach to her work. Our second presenter is Krista Hoy, and she's the Senior Manager of Programs and Evaluation with the Active Aging Research Team at UBC. She's driven to help individuals and communities to achieve health through physical activity by moving evidence into action. And in her role, she leads and maintains partnerships with community-based senior service organizations of all shapes and sizes in communities across BC to implement, adapt, and evaluate the Choose to Move program. And I see that the chat appears to now be working, so feel free to put your introductions and land acknowledgement in the chat now. And as I mentioned, we'll be starting off with presentations on Choose to Move, and then we'll have the Q&A period, but feel free throughout the presentation if you have questions to put them in the Q&A or the chat. So now without further ado then, I will turn it over to Joni and Krista.
Great, thanks so much, Laura. I'm really delighted to be able to be here today. Krista and I are hoping to tailor this presentation a little bit. So as you're putting your names in the chat, if you can also indicate your affiliation, it will help us to decide maybe where we need to spend more or less time within the context of the presentation. So we've already had a comprehensive introduction. Krista, if you could move to the next slide. I would also like to acknowledge that Krista and I are coming from you for what is commonly known as Vancouver, the unceded ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh people. We also acknowledge that our work takes place on Indigenous lands throughout British Columbia and beyond. And as uninvited settlers and guests on this land, we really commit to learning and unlearning and support of reconciliation, and to acknowledge the past and ongoing injustices to Indigenous people. We just observed Truth and Reconciliation Day. For us, we try to embody that work every day with every group that we work with, and acknowledge that ongoing and necessary work. Next slide, please. So today, what we hope to do is really to give you a sneak peek into Choose to Move. And I think there'll probably be varying degrees of understanding of what Choose to Move is. We'll start with the importance of Choose to Move. Why is it important to have a physical activity and social connectedness program? And I think probably I don't need to spend much time on that. I think if you're here today, everybody knows that it's important, but I'll give you a little bit of the evidence just to support that, to describe Choose to Move and its main outcomes. So we'll get a little bit more into, yes, Choose to Move is a program that looks like this, but in terms of its outcome, why is it an effective program? We often have programs that we deliver and they don't necessarily move the dial on physical activity or social connectedness. We know that Choose to Move indeed does that. We've had the privilege to be able to run Choose to Move, supported through funding by the Ministry of Health. And on the research side, we've received federal funding to study its effectiveness. So we know that it does move the dial and that it is a scalable solution to improving physical activity and social connections. And then finally, really wanting to spend time with you folks on this webinar to make sure that you have the information that you need to understand whether or not this is something that your community would like to engage in, and the steps that would be required in order to do so, and to help you to facilitate that. Next slide, Krista. So as I already mentioned, we work in partnership. The Active Aging Society is the entity supported by the Ministry of Health that delivers Choose to Move. We work very closely in partnership with the Active Aging Research Team at the University of British Columbia, which has been supported by the Michael Smith Foundation, or Health Research BC, and the Canadian Institutes for Health Research. And again, that's really about being able to run a program and to understand what makes it effective and how to implement it at scale. Next slide. So again, as I had indicated in this session, we really want to collectively explore this question and share insights from our experience with Choose to Move. In terms of this hour together, as I had identified, we want to talk about why it's really important to have a program focused on healthy aging that's underpinned by the promotion of physical activity and social connectedness, and then a discussion about sharing about experiences in running the program. If there's some of you on this webinar that have had experience running Choose to Move, we'd love to hear from you. And then, of course, the resources to support you to go ahead and run Choose to Move. Next slide. So as professionals, you know that good health or poor health is really as a result of many multiple systems and settings and circumstances that surround us. And I think this infographic really represents the many systems and factors that make up the health landscape and communities, and that we all have a role to play, that there's no one individual or no one sector that can do this work alone, but we're intricately knitted together. And we really, as the community-based service sector, including recreation services, we really need to work together to move the dial on healthy aging. And so if you're feeling like there's a lot that needs to happen in order to ensure the health and well-being of older people, indeed, you are correct. And I think that this graphic really shows that quite adequately. Next slide, please. Again, we know that societal characteristics have a greater impact on our health outcomes than our genes and our biologies and our health behaviors. That's why that previous slide is so important, because it really is the bulk of where we have the limitless of control and able to do better and to support healthy aging. Next slide, please. So no surprise to anybody, feels like the requisite slide that we need to put up whenever we're talking about Canadian demography. But of course, we all know the population is aging. Next slide. We also know that 85% of seniors do not meet physical activity guidelines, and 90% are sedentary for more than 8 hours a day. And of course, this has really deleterious effects on older people's health and well-being. Among our team, we often talk about, you know, we've been through a pandemic, but we also talk about the two epidemics within the older population, one being an epidemic of inactivity, and then the second, which I'm also going to talk about, is the epidemic of loneliness or lack of connectedness. So clearly, when you look at, you know, who's meeting guidelines, it's really most people are not. Next slide, please. And yet we know that physical activity is a major risk factor in terms of mortality. Next slide, please. And again, this may or may not come as a surprise, but when we look at the total cost to the system as a result of physical inactivity, it's significant, including the personal costs. Next slide, please. So we like to reflect upon this particular quote from the WHO often in the context of our work. It's an oldie but a goodie, and that is that when we think about growing older and healthy aging, that maintaining one's mobility is really the best guarantee of being able to cope in whatever scenario. And importantly, mobility and physical activity are really closely linked. So strategies that enhance mobility, we know, or rather strategies that enhance physical activity also reduce the risk of declining mobility. And so when we talk about mobility, there are a few things that go into it, but it's related to, you know, one's ability to move about in whatever manner they use. When we look at all of the health impacts or benefits of physical activity, the impacts and the benefits, we know that physical activity is good for you, that there are a range of studies that tell us, and most studies demonstrate a positive association between physical activity and quality of life. It has a consistent association with functional capacity, with happiness, with mental health, cardiovascular disease, depression, fatigue. If we could roll this all into one pill that people would take once a day, I think without argument, most people would sign up. Next slide, please. So again, sort of just last call out to the importance of physical activity and mobility, that the benefits are huge, both on people's ability to get out and about, but also on their mental health and well-being. Next slide. So I had already foreshadowed when I talked about the two epidemics facing an older population. We know that loneliness is a huge issue among older population. We know that 1 in 4 women and 1 in 5 men feel lonely at least some of the time. And when we look at recent research, we see that loneliness increases risk of all-cause mortality by 26%. So very significant. Next slide, please. So we know that physical activity programs, if you can combine physical activity and social connectedness, this really is sort of the sweet spot that we are able, if we're able to address both of these epidemics at the same time, we're going to be able to address 2 of the most critical issues with respect to an aging population. And the one other thing that I would say is that what we've heard time and time again within the Choose to Move program, and I'm sure this will resonate with most of you on the webinar, that people come to connect. They don't necessarily come for the physical activity. And in fact, sometimes the physical activity from a lot of people feels like a barrier. So one of the I think the really effective parts of Choose to Move has been around the messaging around connecting and supporting people to meet their own goals. And if we sneak some physical activity in there along the way and people are connecting, we know that we're ultimately contributing to people's health and well-being. And we've been able to demonstrate that through our research as well. I'm going to pause there. Krista, do you want to flip to the next slide? And I'm going to turn this over to Krista, who's now going to talk to us very more specifically, now that I've given that overview of why it's important to combine physical activity and social connectedness in a program. And she's going to tell you a little bit about what Choose to Move is and how to get involved. But I'm here in the background to answer questions and look forward to Krista's portion of the presentation. Over to you, Krista.
Thanks, Joni. And thanks everyone for popping your names and what organization you're with into the chat. That's really, really helpful. I see we've got one experienced Choose to Move organization on the call. So maybe Sandy, we can hear from you later about some of your experiences. But really, what is Choose to Move? And I mean, it's the signature initiative of the Active Aging Society. And it's our solution to counter the kind of the twin epidemics of physical inactivity and social isolation and loneliness. And it is an evidence-based program. Our team has been working to evaluate its effectiveness and its implementation in community for over 8 years. And we are continuing that work over the next few years. And hopefully that's why you've joined in on this call, is you're wanting to learn how to become a bit more involved in that work. So just exactly what is Choose to Move? It is a 3-month evidence-based physical activity support program that is facilitated by a trained activity coach. And participants receive 2 different types of support through the course of Choose to Move. The first is a one-on-one consultation where they meet with the activity coach. And in that meeting, they identify some goals and create an action plan to help the participant to become more physically active and socially connected in ways that make sense for that person. I'll get a little bit more into that in a moment. But the other form of support is through facilitated group meetings. And this is where participants come together to chat with each other. It's mostly a discussion-based meeting, but an opportunity for participants to check in with each other, to check in with the coach about how they are progressing with their physical activity plans. If they need to make any adjustments, they can do that in that space. And we really see that the sharing and the connections that are formed within the group meetings as being a real highlight of the program, and really what keeps participants coming back. Um, so talking a little bit more about what exactly it is that participants experience in Choose to Move. So starting with the top left bubble there is goal setting. So first, participants will identify some goals to help them to live a more active and connected lifestyle. And these goals can be quite wide ranging and very specific to the individual. Some people, their goal is to, be able to play with their grandchildren more easily, to be able to get down on the floor with them, or to have a little bit more energy. Some people, it's more, more concrete, and, they want to be able to go for that 30-minute walk 3 days a week, right? So it can be quite wide ranging. And so that's where the choice-based piece comes in. Activity coaches work with participants to create an action plan that includes activities that are of interest to the person and will help them progress towards meeting their goals. And so in terms of the physical activity choices folks are making, again, they are wide ranging there as well. And coaches are encouraging participants to uh, engage in activities within their community. So that could be something like a walking group, or an aquafit class, or a chair fitness class of some type. But it could also be something that's a bit less structured, like just simple walking on their own, gardening, more some of those kind of more occupational type activities. So we really see this choice-based aspect as being a really key feature, as hopefully through the course of Choose to Move, participants are choosing activities that make sense for them, and they, are gain the confidence and develop habits through the course of Choose to Move, so that once the program is over, they have developed these new habits and can continue on with being active in those ways once Choose to Move is finished. Participants are also encouraged to think about social activities that they might want to incorporate into their weekly routines as well, whether that's a lunch program or volunteering opportunities. So again, really tailored to the needs and the interests of the individual. Resource sharing is another key element of Choose to Move. Again, whether that's the coach sharing what opportunities are available in the community, both physical activity opportunities and social opportunities, as well as kind of informational resources. But there's an opportunity for participants to share things with one another through the group meetings, and that often, great ideas come from the participants themselves. So we really see value in providing space for that sharing. Education is another key component. So within each of the group meetings, there is a health topic of focus. Activity coaches are given some flexibility in what those topics are. We provide a menu of different topic options, but things like, the very basics from, physical activity and goal setting at the beginning of the program. And then as time goes on, coaches can choose topics that are of interest to the group, like stress management, sleep, grief and loss is a new topic that we've added in. Falls prevention is a popular one. So we see lots of different topics being of interest to different groups. Social connection, that's really the big one. That's the key thing, the main thing that we hope to see through the group meetings, and the thing that we hear time and time again is the key feature of Choose to Move is that participants come to the group meetings, they talk to one another in small groups and in large groups and with the activity coach, and they really feel like, they are not so alone, that there are others who are going through similar experiences to themselves with becoming more active. Others might be experiencing similar barriers, and they learn how to problem solve together, which takes me to that last bubble, right? So, having group discussions about what do you do when your physical activity plan is to go for a walk twice a week, but then it's raining out and you don't quite feel like it, how do you work around that? So really, Choose to Move is giving participants the ability to think about how to overcome those barriers and how to problem solve, um, both independently as well as with the other members of their group. So the activity coach is really, really key to the success of Choose to Move. And over the years, we've seen a wide variety of individuals who become activity coaches. In the early days of Choose to Move, we primarily partnered with the recreation sector, so municipal recreation as well as YMCA's, and the activity coaches at that time were primarily trained and certified fitness instructors. But as time has gone on, we have realized that individuals can have a wide variety of backgrounds to be activity coaches. Some of our organizations will hire a new individual to be the activity coach, while some will have someone on their existing staff trained up. But the things that we see as really key for the activity coach to have in their list of experiences is experience working with older adults, as well as a really solid understanding of supports and resources available to seniors within their communities. But regardless of their background and experience, the key thing about activity coaches is that they really care and they're invested in the success of each of the participants in the group, and work with them one-on-one to develop and kind of monitor their plans over the course of the program. And over the years, I've had the privilege of interacting with many activity coaches, and we hear time and time again too that you know activity coaches really see the benefit of Choose to Move for participants, but they also see a massive benefit to themselves, and that they are sometimes getting as much from the participants as the participants are getting from them. Yeah, which is just fantastic to hear. So another great element to Choose to Move is that it is very flexible. And so again, as time has gone on, we have worked with a wider variety of types of organizations and settings, and activity coaches. And we see Choose to Move as being very flexible to the needs of each organization. Through the pandemic, we, of course, with everyone else, had to figure out how to continue offering services without being able to do so in person. So now, I mean, a benefit there is that we are now able to offer Choose to Move both in person as well as virtually. So that is a fantastic option for folks who may be in a community where they're not able to offer Choose to Move yet, but might want to share information about Choose to Move with individuals. So we've had our virtual programs have individuals from all corners of the province coming together, which is a unique feature. But we see that Choose to Move can really be customized to the needs of the organization and the participants who are coming in. The schedule can be flexible, the location, all of these things, the topics that the coach is delivering. And we will work with delivery organizations to, fully customize that model as needed based on the organization and the community's needs. So from the organizational perspective, what Choose to Move brings, really, there are a few key benefits. One is strengthening your network. So both from a kind of promotion and recruitment standpoint, we really encourage organizations to work closely with other senior serving organizations in their community, with other, possibly with health providers, other service providers, to share about Choose to Move, so that they are drawing in new folks to the organization. But another way that we see Choose to Move as strengthening your networks is when the coach is sharing information about opportunities within the community. You can we have seen some interesting partnerships form. We had one organization partner with a tap dance society and they brought in a guest instructor to lead a brief physical activity component at the end of the meetings. Well, although there's not a very formal movement component to Choose to Move. We do have some small opportunities within the meetings, and so that's one way that some organizations have done that. One other key benefit is really building capacity within the staff in your own organization. So if you're training a coach from within your staff, they will go through our training, and which will provide them skills, of course, to deliver Choose to Move, but some of those skills can be transferred outside of the Choose to Move context. So more generally about supporting older adults to be more physically active and socially connected, and be connected to other resources within their community. And lastly, broadening your reach. So we see many organizations who look outside of their kind of traditional clientele and are bringing in new individuals to the organization to participate and Choose to Move, who then often go on to become participants or patrons of other programs that your organization might offer. So our team supports each delivery organization in a number of different ways. The first being training the activity coach, which I will talk about in more detail in a moment. But we also provide everything that each organization will need to deliver Choose to Move. I mean, the big one on here that's not on this page is the funding. But we provide recruitment resources. So whether that, it's a planning tool to help support some of those recruitment ideas, as well as, poster templates, news release templates, rack cards, those kinds of things. We have the Choose to Move website that the province. We also provide all of the program materials. So there are, slides that the activity coach can display if they choose to. Again, it's up to the activity coach how they want to facilitate the meeting. But there are kind of guides to help them facilitate each meeting, as well as kind of handouts and other resources for participants. We do provide delivery support. So if activity coaches or organizations come across any challenges or roadblocks in their own delivery, our team is available at any time to help work through those with organizations. And we also host community of practice calls on a regular basis for activity coaches to connect with other activity coaches from different communities and organizations across the province to share ideas and best practices. So the activity coach training is online predominantly. We do have a live kind of Q&A call with a member of our team once folks complete the online portion. We've recently updated the training. So again, here it is a bit more customizable to the needs of the organization and the coach. One thing we heard through our evaluation was that for organizations where the activity coach did not have a formal fitness background, there was a desire for some basic training on kind of physical activity and behavior change, as well as how to support participants who might be living with a variety of chronic conditions. So we have added new modules you can see here to our online training. We also have an overview module that's available to anyone working in a Choose to Move partner organization, just to learn a little bit more about what Choose to Move is all about. And then, of course, all of the specifics that the activity coach would need to do the delivery. If they're doing a virtual program, we have a module here on, some that includes things like virtual facilitation tips and tricks using breakout rooms, that kind of thing. So to give you a bit of an illustration, one of the communities we worked with now a few years ago now, they look quite a bit different than your typical, your rec center in the Lower Mainland. But this is the village of Granile in northern BC, and it's a very small community. Their population is 500, and half of their population was over the age of 65. And their community was too small to offer a lot of the programs and services that a typical or a larger community might have. So they got really creative in how they were delivering Choose to Move some of their recruitment strategies. So they hosted the meetings in the municipal hall. They used the community paramedic for promotion and recruitment, as that individual was very, very well connected to the seniors in the community. They ended up engaging local expert guest speakers to come and deliver some of the content. So again, the paramedic came to talk about falls prevention. And they also ended up using field trips to local nearby communities with other services. So again, teaching, there was an opportunity for folks to learn how to use that local transportation service and have a physical activity outing together. So to date, we started Choose to Move at the beginning of 2016, and so far we've reached over 8,000 older adults through over 800 programs across the province. We've had 95 different community sites, or over 95 different community sites, and we've trained over 150 activity coaches, and we are expecting that number to continue to grow over the next few years. And we certainly cannot do any of this alone, which is why we need delivery partners. And so this slide kind of shows you the delivery partners that we have engaged to date. Again, we're looking to expand that. We know that every organization brings something different and brings a different clientele. We are actively looking to broaden who is coming to Choose to Move. I'll speak a little bit more about that in a moment. But as Joni mentioned, we have been evaluating Choose to Move from the get-go, and through our research, we have seen that Choose to Move works. It does move the dial on physical activity. We're seeing folks who are more physically active, more mobile. They're more socially connected. They have greater access to community resources, and they are feeling less lonely at the end of Choose to Move. And this image here, I love it. It kind of illustrates the beauty of Choose to Move, right? And this, of course, was from a program that was offered, deep in pandemic days, probably early 2021, maybe late 2020. But it really illustrates, why Choose to Move exists. It's for a variety of different community partners and a variety of different older adults. And to give them opportunities to connect and become more engaged in their communities and in their lives. And I think this quote really sums it up quite nicely. And this is from a participant who says, it's very easy as we get older to get narrower. Our circle diminishes. We diminish if we let ourselves. And I think Choose to Move is one tool towards widening the circle, keeping yourself active, keeping your mind active. And I'm just going to pause there before I move on to kind of some of the other supports. Joni, did you have anything to add before I keep going here?
Oh, thanks, Krista. I just wanted to acknowledge that there were a couple of questions in the chat that I've responded to. The question about multiple languages, we're very aware that Choose to Move needs to be adapted to deliver for multilingual populations, and we're committed to do that. We have a couple of communities with whom we work, but if there's a particular group that you're working with and would like to talk to us about adapting Choose to Move for that population, because we know it's not just about language, that there are other adaptations that need to be made to make a program more culturally specific. So we're really committed and happy to do that. So I would say reach out. The other answer to the question is about in the more remote areas. Again, that's an area that we're committed to help support. So it's going to be a similar answer. Like, please reach out to Krista and we can begin that conversation. I also see the question about the proportion of male to female. That is just such a great question. So we have not done very well by older men. We know that we have an archetype of somebody who enrolls in Choose to Move, and it's typically a 72-year-old woman. And again, speaking to an adaptation for languages and being culturally specific, we also know that for our older men that we need to do a culturally specific adaptation, and we're working with a number of organizations to do that, and would be really happy to collaborate and work with others who may have a similar challenge or have had some successes in being able to reach older men.
Thanks, Joni. Yeah, so I will just carry on here with a few different supports. So we have a number of different supports that are available to support older adults, whether you're delivering Choose to Move in your organization or not. So the first is the Get Active portal. So this is on our Choose to Move website. And again, this is a product of the pandemic. We created a library of resources for older adults. So they're, a senior specific exercise and physical activity resources, kind of categorized by these different categories you see here, right? And it's a combination of videos as well as print resources. And I know the print resources for folks, who are dealing with older adults who might not be connected online is a great feature. Joni, did you have something you wanted to add there? No. Okay. Perfect. So the next piece that I want to share with you is our newsletter, the Choose to Move check-in. It goes out every 2 weeks and includes, and it's available to anyone. You don't have to be a Choose to Move participant to subscribe. But there we share different health and wellness resources, physical activity, either a video or a print resource, as well as a challenge to keep folks motivated. And this is just kind of an example of what it looks like. We also have a Facebook page, so encourage you to like and share our page and posts there. Again, we share information about upcoming programs, as well as other kind of health and wellness resources, exercise videos, that kind of thing. And then the last kind of general resource is our Move and Connect webinar series. And so we posted a number of webinars over the past few years where we bring in kind of expert guest speakers to talk on a specific topic. Again, these are targeted towards older adults themselves mostly. There will be one coming up later this fall that focuses on falls prevention. So if you register for the check-in newsletter that I mentioned just on the last slide, you'll get information about that upcoming webinar, but you can check out the past webinars on the Active Aging Society webpage as well. But this is probably why you're all here today, is how to get involved with Choose to Move within your organization, how to become a delivery partner if that's where you want to go. So please visit our website, the Active Aging Society website, activagingsociety.org. And there you'll see under Engage, Become a Partner. And we have a very simple expression of interest form on that page. It's very short. It should be, I hope, very easy for you to complete. It's just a bit of contact information, a little bit of information about your organization, kind of what's your mission, what type of programs and services do you typically offer, and why are you looking to become involved with Choose to Move? And that's it. And once you submit that, someone from our team will follow up with you, and we would have a one-on-one conversation to sort out, where to go from here. Is Choose to Move the right fit for you, and that and such. And we are again, further to the question about, what's the proportion of men and women, we are looking to, diversify who is coming into our program. So if you're an organization that serves more diverse groups of older adults, we are particularly interested in hearing from you. If you have a lot of older men who come in, we'd love to hear from you. We're actively working through our research projects on an adaptation for South Asian older adults. But we are working with other organizations who are delivering in other languages as well. And then the other piece is communities in northern BC, where we're looking to work with those as well. That doesn't mean if you don't tick these boxes that it's not a fit for you. We're open to hearing from everyone. But if you're not sure if becoming a delivery partner is for you just yet, there's other options. So you can refer into existing programs. If there are programs in your community, you can see on the Choose to Move webpage, there's a locations tab where we keep a map up to date of all of the active and upcoming programs, as well as, if there aren't or aren't programs in your community, there is the virtual program offering available as well. But again, really encourage you to subscribe to updates on our newsletter to hear about that. And the last piece is we do have these kind of promotion resources available to you as well. We have posters, rack card templates, our Facebook page. So if you're wanting just to share information with folks and you want some printed materials to support you with that, please reach out and we'd be happy to share those with you. And so that brings us to the end. So hopefully, or we'll get into the questions, but yeah, hopefully this has been informative for you and you've learned a little bit more about kind of the need for Choose to Move and what it looks like and where to go moving forward. So I will stop there.
Thanks, Krista, and thanks everyone so much for joining today and your interest in Choose to Move. I think if you have an opportunity post the webinar today to take a look at some of the resources and think about how it may fit with what you're doing and your organizational needs, we're really happy to hear from you. Krista talked about that expression of interest. You also have both of our email addresses, so don't hesitate to reach out. I think one of the cornerstones of the Active Aging Society has really been to work very closely with partners who are interested in choosing to choose to move, and to try to work within the capacities and resources of other organizations and provide support in order for you to do that. So please don't hesitate to reach out. I see that there's one more question. No. Well, hearing no other questions, I'll give it one more minute and perhaps turn it over to you, Laura, for your formal close. But I really hope that we hear from some of you, and thanks again for joining today.
All right, thank you very much, Joni. And I see that we do have another question in the Q&A box. Maybe we have about 10 minutes left. So why don't we just give a few more minutes if people do have additional questions, as I know it can take some time to type those in.
Krista, do you want to go ahead and answer that question?
Yeah, so interested in presenting virtually for folks who do not want to go to in-person events. Yeah, and we definitely hear that that's still a need in lots of communities. Folks aren't, feeling ready to re-engage or they have mobility challenges. So definitely possibility. So yeah, please do get in touch with us and we can work with you there to see how that could work in your community.
Yeah, and I think, Krista, you had also mentioned too about existing virtual programs that are running. So there's always the option for you to run your own program, but there's also the option to refer into an existing program, whatever makes more sense.
All right, great. And so everyone knows we will be following up with all the participants, and we can send you the link to the recording and then also the slides and then the links to the Choose to Move websites and the expressions of interest. And so if there aren't any other questions, then I'd like to take the time to really thank Joni and Krista for joining us and for providing us with all this useful information. And it's so exciting to see how Choose to Move has really evolved and spread across the province over the years. And I think it's a wonderful program. And hopefully some of you are going to be interested to bring it to your communities as well. So thank you very much, everyone, for joining us. Oh, and I see we do have one last question about research.
We certainly have partnered with community organizations in the past around research. Typically, we're funded to study Choose to Move and its adaptations specifically. That's where we have our research funding. But again, we have partnered with other organizations historically. In particular, those that, would align with Choose to Move.
All right, great. And I guess we can just stay on for a few more minutes just in case there's any last questions, but otherwise we hope everyone has a wonderful day. All right, I don't think there's any other questions coming in, so I will end the meeting then. All right, take care, everyone.
Thanks, Laura. Thanks, everyone.
Thank you.
Thank you. Bye.